Welcome to the Debra Kennedy Show. Tonight we have a very special guest that saves lives. Maybe we don't even know it, but it happens, and it's Dr. Dennis Kokenes. We're so excited to have you on the set again. It's been many years.
It has.
But we had so many emails about your last appearance, and you are a doctor that does many things, and there's like certain areas that you deal with, but one of the key factors that is very important is colonoscopies.
Yes. Colonoscopy is very common now, and most people, you see it on TV sitcoms. They often have shows about it because people dread it, but it's a very easy test at the end of the day. Mm-hmm. The worst part, as many people know who've had colonoscopy, is the prep the night before. Right. But even that's gotten a little bit better. Mm-hmm. You take half of it at one point and half of it later, so it's not all at once. But once you've gotten cleaned out, then it's all easy after that. We make you nice and sleepy and comfortable. And unfortunately, colon cancer is very common. It's the second leading cause of cancer death in the United States. And colonoscopy has been proven to reduce the incidence of colon cancer death. So that's why it's so well covered by insurance, because it's an acknowledged screening test that's more than a screening test. Screening test just looks for cancer, whereas colonoscopy, we remove polyps that can turn into cancer. Mm-hmm. So it's not just screening, but it's cancer reduction.
So when someone does have a colonoscopy and they do have polyps, then that person would come back in, like a normal person that has a clean,
right,
would come every 10 years.
Right.
So the polyps, are they watch areas?
Well, the way it works, so we stratify risk. First off, and this is extremely important, is family history. Mm-hmm. If you have a family history of colon cancer in your family, you should be very vigilant about getting your colonoscopies on time and even a little bit early. In fact, a recent article from the American Medical Society came out recommending that we consider starting colon cancer screening at 45 instead of 50. We're seeing a shift with younger onset colon cancer, unfortunately. But if you have a family history, that's one thing. Then if you have your index or your first colonoscopy, 35% of men and 30% of women will have the precancerous adenomatous polyp that, when we remove it, brings your risk significantly down for the development of cancer. But when you have a polyp like that, that's when we don't invite you back in 10 years, but we invite you back in 5 years.
Mm-hmm. So it's a watch area. So like you said on our little spin earlier, it's really about making the appointment, following up, showing up.
Exactly.
Yes.
And really, it's typically very respectful. It's not painful because we use anesthesia. It's very safe. And again, it's not just a screening test. And that's very important because there are alternatives to colonoscopy, such as the Cologuard test, which is a really wonderful test. Unfortunately, it's a little bit expensive. And if you've chosen to do the Cologuard and it's positive, then you have to have a colonoscopy. And oftentimes your insurance company will say, well, we've already covered that screening benefit, so you'll have to pay for that. So it's a quagmire what to choose.
So what is that test for
the Cologuard is so the Cologuard is a test that came out not too many years ago, and what you do is you have a bowel movement, collect it, and mail it to Rochester, Minnesota, where they test it for a variety of things. Mostly they test it for the evidence of DNA that you would see in a from a polyp or from a cancer. If you've ever watched a detective show, you sip on something and they take the can and they've got your DNA and they can tell everything about it. Well, as the stool goes around the large intestine, it scrapes against the wall. So if there's a polyp or a cancer, it's going to pick up the DNA. And so the stool is tested against an index of DNA commonly found on polyps and cancer. And if there's a match, then they say go have a colonoscopy. However, another part of the test is if you have even a little bit of blood in the stool, even microscopic blood, the test will be positive. So there's a certain amount of false negatives. And I've actually seen cases where a patient had a negative test but had symptoms, and we went ahead and did the colonoscopy and found multiple polyps and early cancer. So it's not a perfect test.
Right.
But for many people, it's a good alternative.
Good. And then you do so many other things as well. And I know as we age, so many people do get GERD,
Yeah.
acid reflux, many things that, follow that probably from taking medicines or whatever it is that we do in life that we get that. Tell me a little bit about that. And
Right. So GERD, or gastroesophageal reflux disease. So gastro means stomach, esophagus. So when stomach contents, mostly acid, but other things too, reflux into the esophagus, they can irritate the esophagus and cause symptoms of heartburn, and actually do quite a bit of damage, and predispose to a condition called Barrett's esophagus, which in a small percent of people can lead to cancer. It's not just aging, but around 40, many people start to have acid reflux and heartburn. And the other big risk factor that we have control over, we can't control aging, is obesity. And that's a huge, huge problem in the United States and in my field, in gastroenterology. It's a big precursor to reflux and to also a very big problem called fatty liver. And we deal with that too. So
so it's what we eat.
It's what we eat.
Environment.
It's so specifically it's caffeine. It's eating late at night and going immediately lying down with a stomach full of food. It's peppermints, caffeines, what we call the xanthine derivatives. It's eating too much at one time. So if you understand the principle that what's in your stomach is going to come shooting up into your esophagus, smaller meals, eat hours before going to bed to allow the stomach to empty, and then maintain a healthy weight, stuff like that.
So this is amazing because it's preventative. So that's something that you can even rectify and change.
Yes. So to speak to the commonness of it, the most commonly used class of medicine in the United States are the proton pump inhibitors, commonly known as Prilosec, omeprazole, Nexium. These are the most commonly used drugs, followed by the antidepressants. I don't know what that says about our country, but there you have it. In any event, many people who are on these medicines find that it's very difficult to come off, because when they do, then their heartburn and symptoms come back. So making these lifestyle modifications, weight reduction, when and how much you eat, limiting caffeine, these are all very important. Unfortunately, there's a lot of literature out there that speaks against chronic use of proton pump inhibitors. And by all means, if you don't need them, don't take them. But the studies that are out there are more statistical observations, not causal studies. There's no studies that prove that omeprazole or Prilosec causes kidney disease, heart disease, Alzheimer's, or any of the other many things that have been but you do see that there's a statistical association. But you'll see that because, like I said, those are common illnesses, and this is the most common used medicine in the United States. So it's inevitable there's going to be some overlap.
Right. But I think if anything, it's like we know now, maybe what to, just not use as much. Like, because we all like to eat certain things and late at night, but you can't do it every night. There are certain times when you do that.
Exactly.
But if you know that what it causes, along with the other things, not balancing your weight, then
yeah, and that would be a good way. If you realize you have this problem, but it's associated with late night eating or drinking more red wine than usual, then it would be a good time to use a Prilosec prophylactically, maybe a couple of hours before a big barbecue dinner.
Right.
And that would be a responsible way to manage it if it's not an everyday thing.
Well, and then one more thing I wanted to talk to you about when you were talking about the fatty part is that I'd heard so many amazing things about the liver transplants and fatty livers, and so tell us a little bit about the liver and the diseases and what the different types of diseases are and how to prevent those. That's a big one. That's a big one.
So you can see gastroenterology and hepatology. Hepatology is the study of liver disease. So liver transplants are performed in Charlotte at Atrium is where they do them, and we send many patients there to be evaluated by them and to be treated for that condition. Fortunately, not most people with liver disease don't end up with a liver transplant, but we're very lucky to have a very good liver transplant center here in Charlotte with excellent doctors and surgeons. The more common times we think of liver disease are alcoholism, avoidable, although alcoholism is a disease and we have to be careful not to be too judgmental, but alcohol certainly. Hepatitis C, a very big infectious disease problem in the United States, and one that was overshadowed for many years by HIV. Currently, we have, and the treatment for Hep C was oftentimes very difficult. The interferon shots, many famous people like Natalie Cole had it, and the treatment for 1 year was worse than the disease for many people, and the success wasn't that good. But today we have drugs that are very safe, and it's pills, and the success is about 95 to 98%, complete cure of hepatitis C. So if you're a baby boomer, make sure you ask your physician to be tested for hepatitis C. It's a simple blood test. And if you have it, there's a cure. And then, of course, fatty liver. This is a big problem. And fortunately, in most people, does not lead to cirrhosis, but can lead to cirrhosis in a subset of people, mostly the ones who have what we call the metabolic syndrome, a combination of more truncal, sort of the apple shape. You don't get to tell your body where to put the fat.
Right.
And so people who have
hard.
but people who have that truncal obesity have a higher incidence of high blood pressure, diabetes, heart disease, and fatty liver, but the more aggressive fatty liver that can turn into cirrhosis versus the more benign fatty liver that some people have.
So what are some of the symptoms of liver disease?
Unfortunately, like many of the organs in the body, there are no symptoms until the liver is so diseased. The kidneys, for example, will work and work and work until you have, maybe 20% functional kidneys. Then all of a sudden you'll have problems. Same way with lungs. People who smoke and tell you, I have no problem, until the next day they're walking around with an oxygen tank because that little bit of functional lung finally gave out. The liver is one of the largest organs in the body, and fortunately it's very regenerative. So if you stop drinking alcohol, it won't go back to perfect, but the healthy parts of the liver will regenerate. An interesting thing about transplants, they're now doing, and they have been for quite a while, living donor transplants. So you can donate appropriately a portion of your liver to a child, for example, and yours will grow back, and that liver will grow to the necessary size for the child.
That's amazing.
It's a fascinating, the liver is very amazing,
Yeah.
but we do have to take care of it, and that means getting screened for hepatitis C, maintaining a healthy weight, and drinking responsibly.
Okay, great. Well, we all know we need to get our colonoscopies.
Yes?
Baby boomers out there, they need to get their test for hepatitis C just to make sure.
That's right.
And the good news is if anything's going on with the liver, it can bounce back and it can be treatable.
And we have the best treatment we've had for hepatitis C, for example, ever. So it's an exciting time.
Well, you are an amazing guest. Thank you so
thank
much.
you.
And really, honestly, you could have saved a life tonight.
I hope so.
So
Thank you
We
so
hope
much.
you hope that it's not another 5 years.
Oh, I'll see you when it's your turn.
I know what that means. Dr. Dennis Kokenes. It really could save your life. So you need to check him out, Dr. Dennis Kokenes.
If you are in the fashion, art, or entertainment industry and would like to be a guest on the Debra Kennedy Show, just go to debrakennedyshow.com and you could be a guest just like me.
Tonight I have a very special guest, Todd Vrcan with CarePatrol, talking about what it's like to experience when the kids become the parents. We, at some point in life, will all experience that. And you help with your company navigating that tool. And lots of times, it's really just starting with assisted living because the parents are at a certain age that, they maybe perhaps want to go to assisted living to be around other friends or, people their age, maybe their spouse died. So that's one level, that's a good level that we start with. Correct, Todd?
That is correct. A lot of times when an individual is not ready or is unable to take care of themselves at home anymore, they're no longer safe at home and they need the socialization and somebody that's always in the community 24/7 to watch out for them.
Right. And that's a really fun balance, I think, too, having a parent decide that they want to do the assisted living, because oftentimes they don't, because they feel like they're giving up their independence and their freedom. And they are. But they also need to be in a safe environment, correct?
Correct. None of our seniors really ever say, hey, I'm looking super forward to going to assisted living.
Right.
It's one of the choices that it's a family decision that helps, advise the family member that, hey, you're no longer safe at home, we're worried about you, we're concerned. Here's a better opportunity for you to socialize, get 3 great meals a day, and live more comfortably.
Right. And I think, too, Todd, I'm not familiar with it, but I think there's all these different levels, too, of assisted living where, perhaps some people have the means to pick whatever assisted living they would like to go in. They can go into one that is spectacular, almost like a Trump Tower. Or there's ones that, perhaps have no money and have to go into state assisted living, correct?
Correct.
And so how do you, is there a fine balance? Tell me the ins and outs of that.
So when we talk with a family member, and it's usually the son or daughter that we're speaking with, we want to understand what's going on with mom and dad. What are their level of cares? What are their needs? What is the location they desire? Ultimately, too, is what is their budget? And we help guide the family and narrow down searches for the best fit for that family based on level of care, location, budget, and desires in a community.
Right. And I would say, too, a big fit would be going to the different assisted livings to see, which one the parent fit in better.
Absolutely.
Because, it's great to get them in assisted living, but you want them, it's something they probably, more than likely, they don't want to go to. But if they find they like it, that's an added bonus, correct?
Absolutely.
So finding the right one's important, correct?
And we encourage mom and dad coming along for the tour because this is their next stage in life, their next home. And it's important for them to realize that this isn't a nursing home.
Right.
It's an assisted living community, and it's so different. Our seniors think back to when their mom and dad were in a facility, and it was a nursing home.
Right.
Today, there's different components of assisted living, memory care, even independent living options.
So what are some words of advice? We're going to go into the different levels too, but what are some words of advice that you can give our viewers out there that are going through this at the very moment? They're at a wit's end. They don't really know what to do. Of course, we have your information to reach out to you, of course. So just give me 3 tips that you would give our viewers.
As they're going through that process, the first thing is just be prepared. This is natural and normal for a senior that as they age, they begin to fall, they have cognitive issues. It's difficult for that family member to accept the fact that, hey, I've got to do something to place mom into a safer environment. So it's really tough for them. Understand mom and dad's budget, their finances, what are their assets, because that's a huge portion of what's required for assisted living, because it is all private pay. And the next thing is having documents and everything in place, the power of attorneys, wills. Those are all the other things that are necessary that as we move through the process, make it smoother for the transition.
I'm going to say that is an excellent point because I'm going to say personally, even for myself, it's a very difficult and challenging conversation to have with a parent, because you don't want the parent to think that you're challenging their funding or want their funding. You're really not. You're really in your mind thinking, how much money do they have to sustain this type of living? And then what happens if they have to go to the next level and the next level, because at some point you're going to have to kick in. So I would say it's a challenging conversation.
It's very challenging, and most people don't want to open up about that, but it's important to know what mom and dad's financial positions are, because you do want to make the best decision for them. You want their money to last as long as possible. If you choose a nice fancy community that is, significantly higher, those funds are going to run out quicker.
Exactly.
So maybe less fancy is better. And not everybody likes that big fancy community.
Right.
They feel more at home at a different, cozier atmosphere.
Because Todd, realistically, you might start in assisted living, but then have to advance very quickly to memory care, or exactly. There's so many
Yes.
different levels of it, correct?
There is. Some individuals stay at home until they reach the point that they're cognitively have declined through Alzheimer's or dementia, and are no longer safe at home, where they're a wander risk and need a memory care unit that's secure. So mom and dad don't wander off and get lost, get hurt.
Right.
But yes, there's assisted living, there's memory care, and ultimately skilled nursing at some point, if it gets to the point where it's a medical necessity.
Well, we appreciate you coming on the set tonight, and I know you told a great story where your wife was involved in CarePatrol, and
Yes.
when you moved here, the franchise was available, and you really wanted to do this to give back to the community and really advise those people, because it is a very, very challenging point in life when we have to make those choices, and having someone that has been through it and knows how to navigate it and makes you feel comfortable with what you're doing for both parties is so important. So just give me if one line, a word of advice for our viewers out there, that you gave the tips, but one thing that can make them feel good about what they're doing and a resolution.
So just realize this is part of life. We all age. Have those conversations with mom and dad early on. Understand what their desires and wants are, and just be prepared for worst case scenarios. Hopefully it's not necessary and mom and dad can stay in their home alone, safe forever.
Right.
But be prepared for those situations that arise, that they need a little extra help.
Thank you, Todd.
Thank you. It's my pleasure.
What an amazing guest tonight, because at some point you already have or will experience that. And it's uncomfortable to have that conversation with your loved ones or parents. But as Todd said, you need to know the funding. You need to know their wishes, more importantly. So what happens if something happens and you haven't talked to them about it, and then you have to make all the decisions? So it's really be aware, have the communication, and have someone that you trust guide you and navigate through the most difficult time of your parents' life, but then probably the happiest.
To view this entire episode or to view other past episodes, please visit our podcast site at DebraKennedyShow.com.
Hi, I'm Valerie from V-Faith Yoga, and today I want to take you through a chair sequence that you can do to relieve some tension, whether it's at the beginning of the day before you start work or in the middle of the day. So you can do this sequence right in your work clothes, and it's going to really focus on your breath and moving your spine those 6 ways. So to start out with, you want to make sure that you have a nice straight seat here. So you're sitting on your sit bones, your feet are on the floor, and you have your shoulders relaxed back and down. The top of your head's going to be floating toward the ceiling, and you can close your eyes here. And I just want you to find your breath. I want you to find your inhales and your exhales. You can do that for about 30 seconds to a minute. And you can close your eyes and just start to maybe calm yourself down, especially if you're having a tense day or if you're starting out a morning that's going to be super busy. And then from there, inhale your arms up over your head. And let's take our right wrist into our left hand and just lean over to the right. Just find that length there in your left side. We're going to come back to center. We're going to take our left wrist into our right hand and lean over to the other side here. Finding that length there. And then coming back to center here and bringing your hands back down to your knees. From here, I'm going to scoot a little bit further up on my chair. And I'm going to inhale, lengthen my spine here. And on the exhale, I'm going to take my right hand to the back of the chair and put my left hand on my right knee. So I'm just finding a spinal twist here. Looking out over my right shoulder. Good. Coming back to center. We're going to do the other side. Inhale, lengthen your spine. Exhale, using your breath, twisting to the left, just finding that twist in your spine. Releasing that tension in your shoulders. Good. Coming back to center here. And if you'd like, you can kind of shake out your shoulders a little bit. And again, you can do that pose several times. And then we're going to bring our spine to the front and back position. So we're going to put our right ankle on our left knee. Coming here, and this is going to help relieve some tension in your back and your hips. Going to inhale, lengthen our spine here. And exhale, use your breath to just fold you forward. Just feeling that release. Coming back up. We'll do the other side. Putting the left ankle on your right knee. Same thing, inhale, lengthen. Exhale, using your breath to fold. Good. Coming back up to seated here. And then just putting both feet back down onto the floor. And again, you can find your breath here. So that is a very quick little way that you can release some tension in the middle of the day. You can take a few minutes at the beginning of your lunch. And you can do those postures as many times as feels good to your body. It's amazing the amount of things that you can do in the chair to make yourself feel better. Thank you so much, and I will see you in the next video.
When you look around, see the tears fall